Well, no.
So, we have a 25-year-old female with edema and tenderness of the left leg. She fell 2 weeks ago, bruising her leg, and she's not taking any medications other than birth control.
Maybe it's an infection. It could be bacterial or parasitic.
Infections often cause lymphadenopathy. Her lymph nodes become too swollen. They wouldn't drain properly, leading to edema. Swollen lymphs also are painful. It fits.
All right. Draw blood cultures to confirm bacterial infection and collect stool samples to rule out parasites. In the meantime, start on broad-spectrum antibiotics.
Have you found what's wrong with me?
We think you have an infection. We're not sure if it's bacterial or parasitic, but whatever it is, it's causing the lymph nodes to swell, preventing them from draining the fluid in the leg. We're going to need blood and stool samples to pinpoint exactly what the infection is.
In the meantime, we're going to give you some antibiotics that should help you get rid of whatever it is.
I'll be okay then, right?
Don't worry, you're going to be just fine.
In your office. Dr. Holmes' office. Is this your office? Okay. So, oh yeah, okay. It wasn't an infection. Blood cultures came back negative, and the stool was negative for ova and parasites.
She's also having a reaction to the antibiotics. Her leg has swollen more, and now it's inflamed. She has hives and experienced anaphylaxis. We gave her epinephrine to counter the anaphylaxis, and we have her on steroids to counter the inflammation.
So it's not an infection. Any other ideas?
It could be some kind of malignancy, maybe lymphoma or a metastasized tumor.
You're only saying it's cancer because you're an oncologist. You see cancer in everything. I could come here with a cough and a runny nose and you'd find some way to call it cancer.
Malignancy would cause pain and swelling in areas where it's including fluid drainage. She also said her father had a tumor in his leg a few years ago.
All right, the two of you biopsy her lymph nodes in her leg and start her on chemotherapy to fight the cancer. And while you're at it, do an MRI to find out how far it's spread.
Wait a second. Shouldn't we confirm it's cancer before we start her on chemo? The steroids we've had her on damage her immune system enough. Chemo would destroy what's left of her immune system. Even if she doesn't already have an infection, this will give her one.
Maybe. But if she has metastatic cancer, she doesn't have much time left anyway. Start the chemo.
It's not an infection, is it?
No, but we think we figured it
You're
out.
going to die.
What's wrong? What is it?
We think you might have a tumor or lymphoma. It's spreading through your body, blocking fluids from draining from your leg.
I have cancer? Well, I guess it's not so bad. My dad had cancer in his leg, and that was taken care of with an operation. When do we operate to get this removed?
Well, the thing is that we think it's spreading. If that's the case, we won't be able to operate. But we're starting you on chemo now, and hopefully that will be enough.
Hopefully. Great.
Yay, chemo. See, I told you it wasn't cancer. The biopsy came back negative, and the MRI didn't find anything. Now we've completely destroyed her immune system, and we still don't know what's wrong with her.
Could be a DVT.
Of course it is.
Okay, you make it sound like you've known that the whole time.
I have. See? It's right here in her file. Even a 30-year-old urgent care doctor at the local clinic would have been able to spot that this is a clot. Pain, swelling, discoloration. DVT fits all these. And she's taking birth control pills.
Birth control pills do increase the risk of thrombosis.
But if you've known the whole time that it's a problem with DVT, why did you run all those tests and do all those treatments?
Well, it wouldn't be very dramatic if I just gave you the answer from the beginning without pursuing a few incorrect options, running every expensive test imaginable, and almost killing the patient a time or two, would it?
Guess not.
Exactly. So we know what's wrong with her, but we don't know why.
Didn't you just say it's because she's taking birth control pills?
Yes, but that's only a contributing factor. There has to be an underlying cause.
Why?
Once again, it wouldn't be very dramatic if everything was the simplest explanation, would it? Come on, people, I need ideas here.
How about a protein C or a protein S deficiency?
Protein C and protein S inactivate clotting factors to prevent the propagation of the clot once it's formed. If they're deficient or absent, that would contribute to thrombosis. What about a snake bite?
Certain snake venoms activate factor 10, triggering the common coagulation pathway. It could also be TTP.
She might have lupus anticoagulant in her system. She could also have DIC.
There's no evidence of bleeding.
Not yet, but maybe it's just early in stages. She's already got one clot, and it could be spreading. Your file says the clot spans the entire length of her thigh.
All right, check her for protein C. Check her protein C and protein S levels and find out whether she's been near any snakes. Do a tox screen just to be sure. Also get a complete blood count to check her platelet levels and do a manual diff to check for schistocytes. Check her for LA. While you're at it, do a PT, APTT, TT, and qualitative platelet studies to rule out DIC.
It's not TTP, DIC, PCD, or PSD. She has no fever. PT and APTT levels were normal, maybe a little low. She's not being anywhere near snakes. She hates them. But her husband wants a Western hognose. Her platelet count was normal, and her platelet function tests were normal. There was no snake venom in her system.
We have to be missing something.
There's nothing missing. It's just a clot.
It's never just a clot. We need to talk this out until we know what the underlying cause is.
No, we don't. But don't waste time thinking this over. This is fine. Why do you need me to talk this over with anyway? You're better with this stuff. Because you're not cancer, and that's what I'm good at.
Everyone needs their Wilson to help them figure things out.
But my name is not Wilson.
You know what I mean. Someone they can talk to organize their thoughts and just straighten things out in their head.
Okay, sure, whatever. But we can make this quick. I've already spent more time on this case than I've in 3 hours.
Where are you going?
I have a conference to go to in Leiden. I've told you this several times. Home? Home? Are you listening to me?
You.
Are you Dr. Holmes?
Yeah. Tell me, has anyone in your family ever had a clot or an embolism?
My dad had a clot in his lungs a few years ago. Why?
I thought so. You have a condition known as protein C resistance. It's most commonly associated with a genetic mutation called the factor V Leiden mutation. You inherited it from your father. If you ask him, he'll tell you his clot was because of it.
Okay, what does that mean?
Factor V is one of the clotting factors in your system. It circulates in an inactive form, but when there's tissue damage, it becomes active. It works with factor 10 calcium and platelet factor 3 to activate thrombin, which activates more factor 10 and factor 8 to keep the whole process moving. And thrombin also converts fibrinogen into fibrin, which forms a net to stabilize the clot. Now, normally your body starts to break down any excess clot and clear out any remaining factors, and protein C is normally responsible for deactivating factor V. However, factor V Leiden is resistant to protein C, and so the clot propagates faster than your body is able to take care of it.
So, how bad is this condition?
It's not so bad at all. We'll get you started on oral anticoagulants, and you'll have to have 2 shots of Lovenox a day for the next 5 days. You'll be on the oral medication for about 9 months, depending on how long the clot stays. And you'll have to come back regularly so we can monitor your drug levels.
Okay, but what if I get pregnant?
You don't want to get pregnant while you're on warfarin. I'd suggest waiting until your 9 months are up. If your clot's gone after 9 months, we'll take you off warfarin. You'll be able to go back your life as normal. If you do get pregnant, though, later on you'll have to have a shot of Lovenox every day to prevent the formation of another clot. And while you're on warfarin, you'll want to avoid eating too many leafy or green vegetables.
Okay.
Any questions?
Kevin, you want to expand on Lovenox a little bit? 'Cause I didn't really
Lovenox
talk about that much, but
its chemical name is enoxaparin sodium. And so I assume from that description it's derived from heparin. And they used, when, this actually is based on a true story. My wife has the factor V Leiden mutation and she had a clot in 2007. And that's HIPAA. That is HIPAA, but she agreed that I could tell you guys. So I'm okay. And they got her started on the Lovenox initially so that they could start fighting the clot until the warfarin levels were up to therapeutic level.
yeah, so you might remember I talked last week about some of the antithrombolytic agents that we have, the direct thrombin inhibitors, the factor 10 direct factor 10 inhibitors, the antiplatelet agents, and then finally I talked about the agents that actually can dissolve clots, and so that's what the Lovenox is. So there's 6 of them that are all approved by the FDA to use right now, and they're actually administered to lyse clots that are there, whereas some of the direct thrombin inhibitors, heparin, those kind of things will help the person, help them prevent the formation of clots. But I just wanted to mention that is one of those antithrombolytic agents that will actually dissolve clots. So, well, Jess, thank you for lending your situation to the case here, your presentation. So,
Did they really start you on chemo? No. That part
he made up.
There's the script and the actual case study is attached to the back.
Okay. So now you know a little more about it too. Huh? 10 extra for what?
The Wilson.
The Wilson. That was good. All right. Well, I'll see you in a little bit, I guess. Oh, and related also what I said last, because I had there was a question about I had it was an error on my slide. So the direct thrombin inhibitors do inhibit thrombin. That was a typo on my slide that came up. So because I think it said. Well, they do work by directly binding thrombin, so not antithrombin. Antithrombin's not involved at all, so that was a typo on my slide. So I apologize for that. And a typo on the outline. So. Okay, nice review and everything today. So I'll see you in a few minutes.